In this video, we are going to look at what happens when the heart starts failing. This is chapter 20, part 10. So as the heart fails, a person really has a decreasing ability to move around or do any type of exercise at all. There are several surgical techniques and even medical devices to help aid someone's failing heart. So first off here, we have a complete cardiac transplant, and this is the replacement of a severely damaged heart with a normal heart from either a brain dead or recently deceased donor. Now these transplants are performed on patients with end-stage heart failure or really severe coronary artery disease. So here on this picture on the left, we can see that the recipient's heart, or what's left of it there, is on the left, and the donor incoming heart is on the right. We do have a partial left atrium left from the recipient, but the rest of the heart is going to be coming from the donor. So here we have the left atrium is sutured to the donor's left atrium is sutured to the recipient's left atrium, which is right here. So we're going to suture those together. You can see that was done right here. And then pretty much for the rest of it, they just need to make sure that they suture together all the correct blood vessels here. So we're going to start with suturing the superior end and the inferior end of the vena cava together, and then kind of suturing everything else up together so that everything is all the tubes are connected to the right tubes with the heart and with the recipient's cardiovascular system. So that's a complete cardiac transplant there. Here we have an intra-aortic balloon. This is a kind of a type of pump that helps the heart to pump. We have a catheter that's placed in near the groin area and comes all the way up to the aorta, into the thoracic aorta here. So we're going to come up all the way here, up to the aorta here. And then this is where we're going to have a pump kind of inflates this balloon inside the aorta, and it pushes blood both backward toward the heart and forward toward peripheral tissues. So it kind of just helps to move blood a little bit more than the heart is able to. So another device here is a ventricular assist device, or VAD. And this is a mechanical pump that really helps weakened ventricles to pump blood throughout the body. And this is so that the heart doesn't have to work as hard. Usually this is very temporary, and it's just used until a heart transplant can be performed. It really is just an additional pump to pump blood through the ventricle, or help to pump blood through the ventricle that's coordinated with the heartbeat. And the last two cardiac devices and procedures are cardiomyoplasty and skeletal muscle assist device. Cardiomyoplasty uses skeletal muscles' innate electrical excitability to kind of implant some skeletal muscle near the heart to help pump the heart. And then skeletal muscle assist device is again using something similar, where we're going to transplant some skeletal muscle to kind of function as this, like it says here, like a booster heart. Kind of just helps with getting that extra contraction force from skeletal muscle. And that's the end of chapter 20, part 10.